A very exciting oral presentation session yesterday for melanoma. There has been some very interesting data, groundbreaking data, I would say. One of the trials that really came across as being very disruptive was from Dirk Schadendorf, a trial where stage 4 patient melanoma that were resectable were fully resected and then randomized between EP-Nivo or Nivo. And I think or control arm. And I think we did not expect to see such a huge difference between the EP-Nivo arm and the nivolumab arm alone. I think we have seen, in very impressive hazard ratio, which was not something again that most of us had anticipated. So I think this is a small trial, 50-60 patients per arm, but I think it could still be practice changing because again I think the pure difference between the EP-Nivo arm compared to the nivolumab alone is so significant that I think it's worth taking into account in our treatment decision. There has been also other studies that reported longer follow-up, very notably the 067 trial from James Larkin was reported. The 067 is EP-Nivo versus EP versus Nivo, and there I think the trend that we have seen, this plateau that is now very well underway, has been confirmed, so this is very encouraging for our patient. We still have this small yet very present advantage for the combo EP-Nivo versus Nivo, although the study cannot, it does not have enough power to distinguish between those two arms. Numerically it's superior, and this difference is apparently here to stay, even a bit greater nowadays. It's probably not much, but I think it's still an important decision factor. Of course toxicity is much higher, but we now confirm that numerically the advantage is clearly for EP-Nivo. There has been also a very interesting abstract presented by Reinhard Dummer on the use of Tyvek in the neoadjuvant setting. This abstract was also quite spectacular because we do see an impact on relapse-free survival and also in OS. I think it's one of the first trials with that power in the neoadjuvant setting. So clearly I think this shows that it's probably the right way to go for melanoma. As soon as you can act on the tumor with an IO compound, I think the better. The big question is, how many patients do we have for which this treatment is possible? Not all patients have palpable disease or macroscopic disease at onset, but I think for those patients, the neoadjuvant approaches are becoming, very promising. It's not yet the standard, but I think it's probably will be at one time point. And then we also have had nice updates on the adjuvant setting. Jeffrey Weber gave us an updated analysis of the Checkmate 238, ipilimumab versus nivolumab in the adjuvant setting. And here I think this really confirms the very nice superiority of nivolumab compared to EP in that setting. Importantly also, nivolumab is much less toxic than EP10, which is the control arm in that trial. So clearly I think this sets the stage for PD-1 blockade to be the standard in the adjuvant setting. We don't have OS data yet. We should probably have this in a year or a little bit more. But I think the RFS is so convincing that this has become a standard already now. And last but not least, we have had an update from Georgina Long on the ABC trial. This trial has two cohorts, one for patients with asymptomatic brain metastasis randomized to EP-Nivo or the same patient population to Nivo alone. I think here the difference between EP-Nivo is quite remarkable. Roughly speaking, there is a plateau at 50%, which seems to be fairly well maintained over time, whereas it's around 20% for PD-1 alone. So I think this really shows that brain metastasis is probably one of the area, one of the clinical biomarker that really points the patients for the combination ipi-nivo. So I think this data really shows the solidity of what has been already presented by Georgina in the previous years, but I think it really shows that for brain mets, clearly ipi-nivo is the best solution that we have at this time. So globally, I think this has been a very exciting ESMO. We have consolidation on very exciting trials, the 067, the 238 and the ABC trial. And we also have some unexpected good news, like the trial from Dirk Schadendorf, really showing that ipi-nivo in the fully resected stage 4 seems to be quite superior to PD-1, something again that we did not expect. So I think clearly this shows that the field keeps on moving, that some of the older results are still showing a very exciting long-term benefit, but also that we are now seeing new breakthroughs, and I think this study on the fully resected stage 4 is an example. Thank you.